I think that things in orthopedics are not static, for sure. Things are really developing now. New technology is kind of blazing the way for less invasive surgery. Arthroscopy being kind of the mother of all of that. One of my pet projects is anterior knee replacements. It's important for women because usually 40 to 50-year-old women can get anterior isolated knee arthritis. They don't need a complete replacement, but if they're not assessed appropriately, they're told, one, they don't have pain, or two, they can't be fixed. And it's really with the isolated patellofemoral replacements or kneecap replacement, they can be fixed and they can go on with their life. They can keep exercising and keep doing things they want to do. I'm a firm believer that you should try things that are easy first. Go through oral medicine, go through physical therapy and injections if possible to keep people pain-free and doing the things they want to do. When those things make it where you can't do the things you want to do, whatever that is, golfing, going with your grandkids, whatever, then it's time to move forward with surgery. Patients, when they come in, see one of my two office staff. Janine's worked with me for 5 years. She's been with me since I started here. She knows everything from answering the phones to surgery scheduling to now she's my office manager. And she's personally involved in all the patient care. She makes sure everything gets done, makes sure everything's authorized. The vast majority of sports medicine type surgeries are outpatient. Rotator cuff repairs almost invariably are outpatient. Stability surgeries are outpatient. ACLs these days are outpatient. All surgeries, I guess. I like to focus on pain control. I do some special blocks that give you pain control. For ACLs, I do a specific block that doesn't shut down your quad, so your chance of falling is less. Your chance of having quad atrophy is less. It's a 3-day block. You have very little pain with the ACL reconstructions, and it gets you back to function faster without the pain. Actually, I use that same block for my total knees. I've started transitioning to that. 3 days of pain relief for your total knee is great. Actually, now people get out of the hospital literally in 1 to 2 days. Get home away from bacteria in the hospital that can cause infections. They get to be with their family under a controlled environment a lot quicker. That pain control stays for about 3 days. It's nice. They actually get too much function at this point. We used to push them to do range of motion. And now it's, I kind of try to limit how much they flex their knee early on because they're not feeling that pain. The vast majority of the things I do are minimally invasive. I try to make things as cosmetically appealing as possible. Rotator cuffs, ACLs, instability surgeries, most of those can be done with just really a couple of poke holes. Literally, you can't tell which shoulder's been done after the surgery. I think that's important both on kind of people's mindset. After surgery or really any time, you have access to us. If you call the office after hours, it's routed either urgently or non-urgently to us. And if you're a surgical patient, you have access to me personally.